Hello, so my name is Danielle Kerr. In this video, I'll be discussing how the approach continuing can be applied to effective prevention of delinquency. So the approach continuum lines up really nicely as shown in the textbook with the risk continuum. From left to right, we're looking at students who are at a minimal risk for behavior issues to children that are perhaps already engaging in that risk. So going from left to right, we go from universal approaches to selected approaches to indicated treatment to second chance approaches. Universal approaches are for those students who are at a minimal or very remote risk for behavior, and those approaches are going to be applied to a large population, perhaps all the children in a school. Examples of that could be a school-wide behavior plan, as my school has, and that can be used to maintain or increase achievement, like I said, in a large group of students. The selected approach would be aimed more at students who show circumstances that increase their chance of having problems. Examples of that program would be maybe a Head Start program, or my district has an extended school year program. And this is for students who are at risk due to maybe some psychological issues such as depression, anxiety, perhaps aggression. For these students, even after participating in the program, it's good to have booster sessions, and those are follow-up sessions with the students that are involved in these programs. It is shown, the research shows, as the textbook stated, that children that attend booster sessions have a better chance of long-term effects from the program. Then as we go over to the right-hand side of the continuum, we get into indicated approaches. Those would be approaches for students that are at imminent risk of having begun to engage in risky behavior already. Examples of this could be an anger reduction treatment program, or also my school has an emotional support alternative classroom for those students that need something more permanent because they're already beginning to engage in these behaviors. The last, all the way over to the right of the continuum, is the second chance approaches. This lines up on the risk continuum with kids that are already engaging in these risk behaviors, such as either substance abuse, teen pregnancy, they've already dropped out of school, and they just need an opportunity to correct their behaviors and to become more constructive in their choices. An example of this could be job training for teen mothers or teens that have dropped out of school and maybe want to return, maybe a GED program. So that is how the approach continuum is lined up with the risk continuum and can be used to effectively prevent delinquency and hopefully manage the risk of some students.